So we've talked about the impact of COVID-19 on public health, the stock market, politics, but what about our kids? It's a big one, right? Dr. Kristen Moffitt is an expert on germs, an expert on talking with kids about germs at Boston Children's Hospital. So she came in with us today. You actually talked to your son's 5th grade class about this last week. Are they talking about it at school?
They are.
Yeah.
They are. I think in terms of what kids have already heard about coronavirus, I think it's very age dependent.
Okay.
5th graders certainly are hearing a lot. They're hearing a lot in chatter at school. They're hearing a lot either on their own social media or their friends are talking about it in terms of what they've heard on social media.
Right.
So they definitely are hearing about it and have a lot of questions.
Were they nervous when they were asking you questions? What was the #1 thing on their mind?
I think for kids, their biggest frame of reference in terms of what they get educated about in terms of viral transmission has to do with influenza.
Sure.
So a lot of their questions related to how does this compare to the flu? Is this similar to the flu in terms of how people get it and how we can keep from getting it and what can we do to keep ourselves healthy?
So my kids are a little bit younger, and we were saying before we started that they haven't said anything to me about it. Doesn't necessarily mean that they're not hearing about it, though.
That's definitely true. That's definitely true. I think if they're younger, first grade and maybe kindergartners, maybe they're not necessarily hearing about it so much at school, but depending on if they've heard about it in news, either on the radio or on TV, they may certainly, it may have crossed their radar. So even starting with a conversation with them about what you've heard about it, if they've heard anything about it at all, and kind of taking it from there.
How do you have these conversations without provoking anxiety? You know, they may have heard that people have died. And if I get it, you know, could I die too? How do you have these kind of conversations, you know, without making them anxious?
Yeah, I think that's a great question. I think starting as a parent with checking sort of how you feel about your own level of anxiety, about what's out there in the news, and getting yourself as informed as possible by going to vetted information sites about coronavirus and how it's being transmitted and how it's affecting us. And then I think beyond that, starting the conversation with them in terms of what have they heard and have they heard anything that's scary to them, and being able to answer their questions to whatever extent you can based on your understanding of the information. And if they've asked a question that's something you don't know the answer to, that's a great opportunity to go and source that information together.
And so you model that behavior with them.
Exactly.